my name's Lauren Lynch, and I'm a physician assistant here at Florida Plastic Surgery Group. Today I will be discussing neurotoxins. A neurotoxin is a neuromodulator that helps temporarily paralyze the muscle in order to decrease the appearance of severe or moderate frown lines. Neurotoxins you may have heard of are Botox, Dysport, and Jeuveau. These are the 3 neurotoxins that we inject here at Florida Plastic Surgery Group. Patients commonly ask me what is the difference between Botox, Dysport, and Jeuveau, or one to the other. I commonly refer to this or give an example of it's like having ibuprofen, but ibuprofen is the generic name that is also found in Motrin and Advil. So just like ibuprofen is found in Motrin and Advil, botulinum toxin A is what is actually found in all 3: Botox, Dysport, and Jeuveau. Botox has just become what we synonymously think of when we talk about neurotoxins. Just like some patients have different reactions or responses to Motrin versus Advil, different patients can have different responses and reactions to Botox versus Jeuveau versus Dysport. The manufacturing process is slightly different for each one of them. In terms of longevity and time to start seeing an appearance, Botox usually starts to kick in around 7 to 10 days, and Dysport usually starts to kick in around 3 days. Jeuveau is one that I won't be commenting here too much today because it's a newer product on the market and we haven't seen a lot of the studies coming out or a lot of longevity in the studies at this time. Some of the common side effects that you can see after injection are usually just going to be swelling or redness at the injection site. Another thing that you have to be careful of is something called eyelid droop. Eyelid droop happens because some of the neurotoxin has actually migrated into an area to affect the muscle above the eyelid, or the muscle that actually elevates and opens your eye. This is going to be based on your technique of your injector. So one reason why it's very important to actually have a well-trained and properly trained injector when doing any 3 of these. A properly trained injector will also be able to take into account elevating muscles versus depressing muscles of the face. The areas commonly treated with these products are going to be in the forehead, the frontalis muscle, the orbicularis oculi, which is going to be the muscle that affects the crow's feet, and then the procerus muscle and the corrugators in an area commonly referred to as the glabellar area. A well-skilled and properly trained injector knows how to balance these muscles so you don't have something that can commonly happen called a brow droop, or something where you can create a Spock eye. A Spock eye being where you just have extra pull over here on the side of the eye. Again, these are things that can be corrected with addition of additional units down the line, properly placed again. Technique differs from injector to injector and is based on the patient's anatomy and the desired result. Another question that's commonly asked is how long will the product work and how frequently do I need to have it injected? The products, all 3, typically are approved for about a 3-month time period, in which time you'd have to come in and be re-injected with either one of the products. Now, if you have Botox on one visit, you can absolutely have Dysport on the next visit. Again, we like to space these typically 3 months apart. We usually try and avoid injecting in areas where you have an open or active infection. We also want to decrease the amount of time it's been since you've had a blood thinner, ibuprofens, Tylenols, or any blood thinning agents that you may be on or prescribed. One other thing that we typically educate patients about after injection is to not massage the areas of injection. The neurotoxin is placed within the muscle. It usually has about a 1 centimeter diffusion, and we don't want anyone massaging it to move the product into other areas, especially as we spoke about around this area of the corrugator where it can fall and affect the levator palpebrae, or the muscle that elevates the eye. That would be one specific area where we want to avoid massaging the medication. Patients who should not be injected are any patient who's ever had a previous reaction to a neurotoxin in the past. So if you've ever had a reaction with Botox, Dysport, Xeomin, Jeuveau, or any other neurotoxin on the market, you should not be injected. Other patients who should not be injected are pregnant or breastfeeding mothers. Thank you for joining us today here at Florida Plastic Surgery Group, and we look forward to seeing you on our next video.